Here we are doing the WHO surgical safety checklist. It's very important in terms of standardization of all the checks which is happening within the theatre during patient's journey. And it is shown to reduce human error as well as improve the communication within the team so that they can raise any concerns when they see within the theatre environment, especially when doing an operation.
The 5 steps to safe surgery are designed at trying to avoid the human errors and factors that may contribute to mishaps in surgery.
Historically, we just came in and did the list, and this now to me feels though we're getting to know the whole team, any comorbidities about the patient, so the patient gets a better experience within the whole theatre environment and all the perioperative care is carried out.
It's all about just double checking all along the line so that every process, stop, just ensure everything is correct before you proceed.
It makes it a more kind of even environment for everybody that's in there, so it gives anybody the opportunity to raise a concern without being worried what everybody else is thinking.
Good afternoon, my name is Maria. I'm clinical leader on Scrub. So step 1 is team briefing. Team briefing occurs before the list actually starts. We all meet and discuss the list order, what patients we have on the list and what their anticipated surgery is. It's a time where the staff all introduce themselves and raise any concerns they may have about the list. Anything that we need to know about? Anything unusual?
Generally fit and well.
Okay. It is a time to discuss both the anticipated plans for the surgical lists and any anticipated safety concerns, both for the anaesthetic and surgical point of view, including any alternate plans should the unexpected occur. It brings the whole team together, enabling staff to feel empowered to raise any concerns about the patient care and safety.
The anaesthetic practitioner will check the patient's wristband against a consent form and the operating list. We also check the patient if the patient has any allergies and if they have any metal work in their body such as plates and pins. The patient's skin integrity must also be recorded on the sign-in sheet, and any pressure sores or tears in the patient's skin must be recorded. If the patient is having a regional block, the site and side of the block must be double checked with the anaesthetist and the ODP with the patient before the anaesthetic block is put in. The patient's baseline observations are also recorded on the WHO checklist. This includes their blood pressure, the saturation level in their blood of oxygen, their temperature and their heart rate.
Mixed to forceps, some 2 to forceps, Mayo instrument pin.
Step 3 is timeout. The whole team takes time to pause before skin incision.
Are we happy that we all know each other?
Yes.
Are we happy with the verification checks, wrist bracelet, consent and operating list?
Yes.
At this point we check all the patient details against the checklist and raise any concerns or uncertainties before proceeding with the surgery.
Will the surgeon please confirm the planned procedure against the consent form?
In the morning when we go and see all the patients prior to surgery, we do check all of these details, but then you've got multiple patients' details in your head at the same time. It's very easy to confuse things in that interim before you actually start a procedure with the patient. So it's a good point to pause, make sure everybody knows what's happening, and then if something happens or doesn't go according to plan, anybody can raise that concern.
Step 4 comes once the surgery is completed and before any members of the team leave the theatre. Will the surgeon please confirm the full procedure that's been performed, including side and side?
Left hemiparodectomy.
This is where the recording for the surgery will be completed and documented during the sign out. Are there any issues to be added for discussion at safety debrief?
No.
The instruments, swabs and sharps will be checked and confirmed by the surgeon. Specimens are confirmed to be labelled and any post-operative management will be discussed and handed over to the correct team members, so in particular the recovery team who will look after the patient once they leave theatre. So what went particularly well and did anybody have any concerns?
Step 5 is where after the final surgery we do a debrief with the entire team present before people disappear, and at that debrief we will discuss any problems or issues that there may have been with the list, seek ways to resolve those and ensure that actions are put in place so that things are resolved and recorded for the next list.
Are there any issues to be addressed prior to the next list?
No.
So the introduction of the 5 steps to safer surgery has made a real difference to patient safety, and the National Patient Safety Agency are now providing data to show that it is really the only way that's affecting a strong cultural change, which is what's required.
It helps include the whole team in the process during the operation, and it's a good safety procedure so that nothing gets missed out, everything gets checked.
It's also quite useful for me as a relatively new member of the team or a trainee that moves around from site to site. It makes sure that I actually know who everybody is, and introduction's a good part of it without that feeling awkward for anybody in the team.
We are already showing that patient safety is improving with the introduction of these simple steps.